Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jargos. Today I'll be doing part 6, that is the last part of J.H. Allen, Tertiary Lesions of Psychosis. Usually the first tertiary lesion to manifest themselves are the skin symptoms, and this is in agreement with Hahnemann's theory of the disease. So whatever tertiary lesions they manifest themselves, they are in the form of the skin lesions. Now, what are those skin lesions? Let us see in the next slide. So according to theory, Hahnemann's theory of disease says that the disease is evolved from above down, downwards, and from within outwards. So the important point is from within outwards. It is a life-saving and it protects the internal organs from being affected. So whenever the tertiary lesions are there, or they manifest themselves in the different forms of the different skin symptoms, it helps us to protect the vital organs. In other words, the internalization of the disease is avoided. So the disease will not travel the disease will not travel to the more deeper planes and will involve the vital organs, which may be a threat to life. So the most important point out here is that it prevents the internalization of the disease. When tertiary developments do not come out as skin lesions, malignancies are almost certain to follow. So if the tertiary skin lesions do not come out because of suppression, then the malignancies will definitely be manifested. This is because there is no other way of preventing the centralization of the tertiary forces upon the internal organs. So why does this occur? Because there is no way in allowing the disease to go into the more deeper parts of the body, that is the affection of the vital organs. The malignancies that J.H. Allen refers to as cancer are carcinoma, lupus, epithelioma, and a tendency towards diabetes mellitus, Bright's disease, and tuberculosis. All of these develop from psychotic taint on the system. So the psychotic taint is there, which is responsible for all the different diseases which will develop if the tertiary phase is suppressed. Even fibrous changes are quite often malignant in their outcome, especially if internal organs like the uterus, kidney, liver, or heart is involved. So therefore, he also says that, Dr. J.H. Allen also says that the fibrous changes also, they may be seen in different parts of the organs like uterus, kidney, liver, or heart. The first skin lesion that we meet with are warty eruptions or warty growths. So the first tertiary skin lesion is the warty eruptions or warty growths. These appear in the form of verruca filiformis, verruca vulgaris, and verruca plana. So different forms of verruca are there, which they may have their manifestations on the skin. So to remember, the first skin lesion are the warty eruptions or the warty growths in the form of different forms of verruca. The accumulate from belongings to the condylomatous family and therefore no doubt partake of both the venereal miasm, syphilis, and psychosis. So the verruca accumulate is there. It is a form of a condylomatous outgrowth, or it belongs to the condylomatous family. So it has a miasm of both the syphilis and the psychosis. Warts are diagnostic value which help us to distinguish between the different stages of the disease. So the warts are there, the types of warts or the different types of warts will tell you or will help to distinguish the different stages of the disease. For example, the verruca vulgaris is found in children who are suffering with hereditary psychosis, and they appear at or about the second dentition. The verruca filiformis comes as a tertiary lesion in an acquired form of psychosis, and the verruca plana juvenilis is another hereditary form found more or less upon the backs of the hand and faces of children and young people. They are usually pigmented, disseminated, and present in irregular and unilateral groups. So he's describing to you the different forms of the verruca, where they are located, and in what time they will be seen. So the time dimension has been mentioned. The filiform variety appears in adults who have acquired psychosis and who have had the disease suppressed in some way, although they may appear after secondary inflammations have subsided. So the another form of wart, that is a filiform wart. It is seen in adults, especially those who have acquired psychosis in the walk of life, and naturally the disease has been suppressed, and they appear after secondary inflammations have subsided. Dr. J. Allen says, I have met with them frequently after operations upon internal organs, especially after extirpation of organs such as the ovaries of the uterus. They are more apt to appear on and about the sexual organs or on the trunk of the body, quite frequently groups of a dozen or two, closely running together in fields or patches. So again, this is the filiform type of wart. The location is seen and the time period is also seen. They are smaller in diameter and colored and brownish or gray brown. So they are small in diameter or they are small in size, and it has either a brown or a grayish brown color, pointed at the ends with spindle-like attachments, and they are pointed with spindle-like attachments. When they appear in children or young people, we find them about the eyelids and on the neck. So in children and young people, it is seen on the eyelids and around the neck. Occasionally, these disappear spontaneously and some other tertiary region takes their place. So he says that occasionally they may disappear on their own and some other tertiary lesion may take their place. J.H. Allen gives examples of 3 cases where they had made their appearance after operation. So you can read this in the book. 3 small cases have been given about the same. When a tertiary eruption makes its appearance, the suppressed discharge or gonorrhea cannot be reproduced. So Dr. J.H. Allen says that when a tertiary eruption makes its appearance, the suppressed discharge of gonorrhea cannot be reproduced. So whatever suppression is there, that cannot again come out, or there will not be any return of the original symptoms. This makes psychosis to become slow and difficult to cure. So naturally, whatever is suppressed, if you do not bring it out to the surface, the cure will not take place. Therefore, it makes psychosis difficult and slow to cure. Same is applicable to the tertiary stage of syphilis, which is closely bonded with the sora miasm, and it becomes difficult to separate. So in a similar fashion also, the tertiary stage of syphilis also, which is bounded, the syphilitic miasm is bounded with the soric miasm, it becomes difficult for it to separate. In contrast, when the disease is suppressed in the primary or secondary stage and has remained in the latent stage, we have very little difficulty in reproducing the discharge. So if you see in contrast that if the disease is suppressed in the primary or the secondary stage, then with little difficulty, you can establish the gonorrheal discharge and the cure will take place. As compared to the tertiary lesions on the tertiary stage, where it is very difficult for the gonorrheal discharge to take place again or to have the return of the original symptoms. So in these diseases, when they are suppressed in the primary or secondary stage, the gonorrheal discharge can be established. So remedies like medurinum, nux vomica, sorinum, sulfur, calcareous carb, and others of the class makes the treatment easy if taken in the first and second stage of suppression. So if the disease is counteracted in the first and second stage when suppression takes place, you will be able to cure the disease, or it will be easy for us to establish the suppressed discharge and the cure will take place. Thus, our only hope lies in reproducing the original disease in order to cure any secondary disease. So therefore, it's quite simple that if you want to cure any disease, you have to reproduce the original disease, or whatever original disease was suppressed, that has to come out, whether it be stomach troubles, indigestion, hemorrhoids, headaches, neuralgia, rheumatism, or constipation. The same holds true for an acute expression wherein the suppressed discharge is again returned. So it not only holds true for the chronic expressions, but also for the acute disease or the acute expressions. The cases linger on if mineral baths, hot springs, mud baths, hot air baths, electricity, and local measures of all kinds are used. So if, however, other suppressive methods like those mentioned here, mineral baths, hot springs, electricity, etc., when they are used, they will also cause suppression. And in that case, it may take longer for the case to get cured. The verrucal eruptions, when removed surgically, is certainly to be replaced by some other disturbance or manifestation of psychosis. So, even if you remove the wart or the verruca surgically, surgery also is a form of suppression, whereby you will see that after some time, the manifestations of psychosis is seen in some other part. Occasionally, they reappear at the same point after removal or in other parts. So, when the verrucas are removed, they will again reappear at maybe either at the same location or in other parts. Hence, disturbances like headaches, neuralgia, rheumatism, stomach troubles, gouty states of the joints or organs follow. So, when the verruca are removed surgically, they may again reappear at the same location or at different parts. And once they are removed, other disturbances like headache, neuralgia, rheumatism, stomach trouble, gouty states will follow. The tertiary manifestations of all the miasms, whether psora, syphilis, or psychosis, though slow in action, often involve the more central organs and the deeper structures of the organism. So, whatever be the miasm, maybe psora, syphilis, or psychosis, whenever the tertiary manifestations are suppressed, they go into the more central organs or they go into the more vital organs or the deeper structure of the organism. Besides the wart, another manifestation of the tertiary symptom is the red mole. So, Dr. J.H. Allen now introduces us to another manifestation, that is the red mole. It appears on the chest or anterior portion of the body. It varies in size from that of a pinhead to that of a pea. So, the size varies from a pinhead to that of a pea. It is smooth, round, shiny, often red as blood, and of the appearance of a polka dot upon the skin. So just like a polka dot, its appearance will look like a polka dot upon the skin, as it is red, shiny, and as if full of blood. This eruption is a positive sign that they have either acquired psychosis or their parents have acquired it. So if the red mole comes up, it is a definite sign that the patient has acquired psychosis or the parents have acquired it. Now he introduces us to another variety, that is the spider spot. The spider spot, another specific psychotic lesion, is generally found upon the upper portion of the face, usually about half an inch below the lower eyelid or over the center of the malar bone. It consists of a little sprangle of dilated capillaries resembling somewhat the meshes of a spider web. So the spider spot is seen apart from the verruca and the red mole. It is seen upon the upper portion of the face and about half an inch below the eyelid. And it has dilated capillaries just like the meshes of a spider web. This is particularly a tertiary or hereditary lesion and is found in children about the period of secondary dentition, but it may be at birth. It increases in size up to puberty, where it remains stationary. It requires 2 to 3 years to cure one of these cases. Only the highest potencies have any effect on it. So J.H. Allen says that he has used Finke, Skinner's, and Swan's remedies in the highest potencies, CM, DMM, and CMM with good results. Another manifestation is the psychotic acne, which are generally seen about the time of the menstrual period. So another manifestation is the psychotic acne seen in females at the time of about the menstrual period. The chief feature of psychotic acne is the large, reddish, blunt, pointed, angry-looking lesion that is sore and sensitive to touch, non-suppurating, and appears quite isolated and separate from each other. They are not in groups as found in the psoric and the tubercular forms. Lupus belongs to the tubercular family of skin disease with a psychotic element present. Now, something about lupus, it tells us that it belongs to the tubercular family of the skin disease, but it has a psychotic element. All three miasms, however, will be found in lupus patients, but psora and syphilis alone will not produce lupus. So all the three miasms, psora, syphilis, and psychosis are there. And he says that only psora and syphilis alone will not produce the lupus condition. Lupus often appears at an early age. A history of these cases will usually point to a suppression in the parent or to an imperfect cure. So whenever lupus is there, and if you take the case history, you will find out that there is some suppression in the parents or a cure which was imperfect due to suppression. It becomes difficult to cure because of the mixed miasm present. So lupus will become difficult to cure because of all the presence of all the three miasms. So it's a complex miasm or it is a mixed miasm. In all forms of ringworms, we see the specific psychotic element running through all the manifestation. Now something about ringworms. He tells you that in ringworms also, he says that in all the forms of ringworms, the psychotic trait is present. Suppression of ringworm in any form means the suppression of psychosis of a specific nature. So, since the psychotic element runs in all the forms of ringworms, if you suppress the ringworms, then you are suppressing the psychosis. And the invariable result of its suppression is ill health, such as a form of rheumatism or the development of chronic headaches, stomach troubles, etc. So, when the ringworms are suppressed, or in short, in other words, when the ringworms are suppressed, as a result of which there is suppression of psychosis, the patient may develop rheumatism, chronic headaches, stomach trouble, etc. The suppression of ringworms means the suppression of a specific form of psychosis. Again, is reminding you that since the psychotic manifestation runs throughout all the different types of ringworms, the suppression of ringworms means the suppression of a specific form of psychosis. It is usually upon a latent tubercular base. For a tubercular patient, are the only ones who contract some of them of the many forms of tingling. So the ringworms, the base is the tubercular base upon which the psychotic manifestations are manifested. So therefore, it becomes difficult to treat because of this tubercular base. Other diseases which have psychotic base are variola, herpes zoster, impetigo, psoriasis, and gout. If we examine the patients, we find all sorts of pathologic changes in the form or size of the organ, changes in the valves, hypertrophies, softening of the valves, dilatation, and slow, soft, or intermittent pulse. So, Dr. J.H. Allen says that if we examine the patients, we will have all these changes seen in the patient. In cardiac diseases, they have no pain to speak of, occasionally a sharp thrust or a dull ache. So, in patients who are having cardiac diseases with psychotic background, generally they have no pain to speak of, but occasionally sometimes you may get a sharp thrust or a dull ache in the region of the heart or the region of the chest. We hear of sudden deaths of our great men, senators, businessmen, and those who have led a sedentary life. So, who are more prone to these attacks or the heart attacks? The people who live a sedentary life, like senators, businessmen, etc., or who take spiced or imported wines and other intoxicants, or people who are habituated to taking some alcohol or especially wines or other intoxications. Wines in any form are more harmful to them than any of the stimulants or intoxicants. J.H. Allen says that whenever a psychotic base is there, the psychotic miasm runs through the disease, wine in any form is harmful. They are more harmful than even other stimulants or intoxicants. Those people are fond of aromatics, mustard, pepper, condiments of all kinds, rich and stimulating food. So it will be seen that these people who have a psychotic base of the disease or the psychosis runs through the disease, they are fond of all these spicy condiments and stimulating food. Narcotics of all forms are the greatest excitants of a gouty diathesis. So, in the gouty patient, narcotics are of a great excitant to them. They meet with sudden death, often from valvular disease of the heart, from pneumonia, peritonitis, gastritis, or hepatitis. So these people who live a sedentary habit in which the psychotic trait is present within them, who are more habituated to taking intoxications and other stimulants, especially wine, you see that these people will meet with sudden death, especially from valvular disease of the heart, or maybe even pneumonia, peritonitis, gastritis, or hepatitis. Now, something about the cough. The coughs of the psychotic patients are usually bronchial. So, the origin of the psychotic cough is a bronchial cough. They are forever having bronchitis, hard, tight, dry, racking coughs, frequently met in the early fall or winter. So, when winter sets in, or when early fall sets in, or when the winter is just starting, they have this affection of the bronchial tubes with dry, hacking, tight cough. There is much sneezing with a profuse watery flow from the nose. In a few days, it passes down into the bronchi, and they have a week or 10 days or longer of coughing spell. So once the discharge settled into the bronchi, it will take around 7 to 10 days or even longer for the coughing spells to start. Expectoration is usually scanty, and they cannot, as a rule, breathe through the nose, or there'll be nose block. They will have difficulty in breathing through the nose. If they should escape these troubles, they have rheumatic pains or muscular rheumatism of the least exposure to wet or dampness or a chill. So Dr. J.H. Allen says that if they escape these troubles of bronchitis, then they may be manifested with rheumatic pains or muscular rheumatisms, which are aggravated from the least exposure to wet or dampness or even a chilly wind or even a chill. They are affected by rains, the cold, or any rise in the barometer reading. So any change of temperature, any fluctuation of the temperature of the surrounding temperature will aggravate their muscle. Excuse me. Will aggravate the muscular or the rheumatic pains. In rheumatism also, all sorts of local measures are employed. So in rheumatism also, the person or the patient have also taken local measures like water baths, electricity, etc. Especially sulfur and alkaline water seem to palliate them, yet frequently they are only slightly of temporary benefit. Also, drinking water of an alkaline character neutralizes to some degree that excessive acid condition of the blood from which the majority of the patients suffer. Lastly, the change in diet and regimen benefits them much. They become sensitive and irritable patients who have so stimulated and palliated the nervous system that they now become super sensitive to pain. So all these things will modify the rheumatism, and as a result of which the patient becomes very hypersensitive, irritable, and super sensitive to pain. So that's all what Dr. J.H. Allen wants to tell you about the tertiary lesions. And now I will stop here because the other chapters will be taken on later on. And I'll be doing now my next video will be on the next book by Ortega, Notes on Miasm by Ortega, which I'll be completing. And then I will again take the remaining chapters from this book. Hope you all enjoyed all my videos. And if so, do give my videos a thumbs up. Thank you very much for the patient listening.